Alzheimer's disease is getting more and more common because we're living longer. And it used to be years ago we were dying of heart attacks and of cancer. We are preventing heart attacks by exercising and taking medication for high blood pressure and for cholesterol. And we're cancer early because there are all sorts of screening processes that we do so that many cancers are discovered at a much earlier stage, which we can then be treated, tumors can be removed, and we're living for longer. While we're living for longer, many more of us are going to have Alzheimer's disease. So this is a major issue in the Western world. Lancet is a very influential medical journal. They came out with a bunch of things that have been proven, huge studies following people up for many, many years. But if you exercise, eat right, watch your weight, and stay mentally active, you can actually decrease the risk of later getting Alzheimer's disease. So that's something that's important for you to know. And the other good news regarding Alzheimer's disease are some scientific, I'm not sure about breakthroughs is the right word, but there are some encouraging scientific developments, including medication, which are focused again on a substance called amyloid, which is part of what gets accumulated in the brain and which causes the disease, at least in some of the cases. And there are medications that are now literally just now being approved, which can decrease the amyloid load and decrease the progression of the illness. So these are medications. It's important to use them in the very early stages of the illness so that as we get older, it's important to know part of normal aging is you can have cognitive problems as part of normal aging. I forget the name. What's the name of that person? I've known this woman for 20 years and I don't remember her name. That can be normal. Okay, and there's probably no need to run to the neurologist because you forgot somebody's name. But when these things get worse, and what's most important is when there's a downward trajectory, when you start out forgetting somebody's name, but then you forget other people's name, and then you forget other things that you should be remembering, etc., etc., that's when you should perhaps go to a neurologist or a psychiatrist sooner rather than later, because if these are the early stages of dementia, there are now medications that are able to somewhat delay the progression of the illness. This is something that's a relatively new development. There was a previous drug that was approved but then banned by the FDA. Now there's a new drug that has been approved by the FDA. And what's most important about these drugs is that they encourage more research in the field and help us dig deeper and understand more about how these illnesses develop.